Whoever thought that dog fat could be so good? We're here talking about such matters. A little bit later, we'll be moving on to the Secret Service protecting the president and vice president. Outstanding, interesting new book out, and we'll be talking to Ron Kessler about that in just a bit. He'll be on the phone, but on the set to my left is Mike Hutchinson, you know him from KDK Radio, has a talk show there, Ask the Vet, or something along those lines.
Yeah.
And it does exceptionally well. People are, of course, excited right now with this development as we talk about adipose stem cell procedures and the kit that you've been describing. I mentioned a moment ago as we left the last segment that there are still questions, such as how long does this last?
That's it. We don't know. We're in the infancy right now. I have dogs that have gone over 2 years. My first case was in March of 2008. So, like I said, since then I've done close to 100 procedures, but that's the longest that I have experience with. I can't go further than that. They've done it in the horses since 2003, and we're hoping that we'll get in young animals 2 to 3 years of benefit, because remember, aging, as you said before, is a degenerative process. So it continues. We're putting in repair cells. We're trying to stop the process. Hopefully we don't re-injure. But when you get these old arthritic animals, the cats that can't get back in the litter box, they're having trouble getting up the stairs, the dogs that can't get up the stairs, the horses, they have their racing injuries and whatnot, and their sports injuries. We're just hoping to get in there and repair and give them some good quality life, and that's the key. Animal
General with Dr. Mike.
Yeah.
And I want to get to this element of it, though. We don't know basically what the future is and how this will play out. There's still questions about that. And yet I need to get something out of you that you mentioned a moment ago. You said you had 5 years of research. How much time do you think you'll need? And I know you've been a leading advocate of this. How much time do you think you'll need before you say, okay, we have enough of a representative sample for me to have an opinion on the long-term use of this?
Well, it's probably going to be another 3 to 5 years after the first procedure. So probably in 2011 to 2013, I'll have a pretty good opinion, because I think I'll know. If it's still going strong in those dogs, I'm going to be at the top of the roof shouting, because that's pretty amazing. But you're talking about what's going on. There is a lot of research going on right now where we're looking at the internal medicine applications. In other words, we give it intravenously to these animals too. I always include that with the treatment, because intravenously they don't have any reactions. They say that these cells aren't that immunogenic, which means that they're not likely to cause an allergic reaction, which is nice. We inject them intravenously. So far I haven't had any side effects at all. And we hope that they'll go and repair, maybe down the road, hepatitis, pancreatitis, things that cause diabetes, heart disease, things like that, kidney disease. Certainly allergies, which just about every person listening knows somebody that has an animal that has allergies. And we're not going to cure the immune system. They're working on this with MS, autism in people. They're doing Lou Gehrig's disease, things like that. There's a lot of applications coming down the road. I am privy to some research that's going on that I had to sign some non-disclosures, and I'll go far as saying this, Ellis, that I believe in 2 years we're going to see cures from stem cells, adult stem cells, for diseases that I never thought were curable in my career. I have 5 children. I prayed one day that they'd see some of these cures, and I believe that I'm going to be seeing them and actually witnessing them shortly.
On the human level?
On the human and the animal level,
okay,
which is pretty amazing.
Yeah, and obviously the controversy will rage on in some respects, particularly as it relates to the humans, but I have to ask you, you mentioned a moment ago the idea that animals in some respects are guinea pigs in this. The success certainly, particularly if it broadens its application in animals, will create a bit of momentum in that conversation as it relates to human beings.
That's absolutely true, and I'll tell you right now, today, there's probably 30 of these procedures that I'm doing in animals being done in humans this week. And
wow.
In Florida, in California. And I'm not talking about bone marrow-derived stem cells. I'm talking about adipose or fat-derived stem cells, which is neat. Now, if you took a, for the people listening, if you took a cup of blood, just took a blood sample and took a cup of blood, there'd maybe be 100,000 stem cells in that cup of blood. Take a cup of bone marrow, there's about 1 million stem cells in there. You take a cup of fat, there's 1 to 2 billion stem cells in there. We don't have to culture them. That's why we're able to do them in-house. We're able to process them. We're getting such good numbers that we can send them back into the body to repair.
And I have to go. But quickly, the numbers, speaking of, are down in terms of the cost of this. The numbers for a vet, though, could be very profitable if this thing works out.
Absolutely. Well, it's another tool that we have, regenerative medicine. We never had that before. So anytime you enter a new tool, it will employ more people.
Okay. Well, we imagine that there'll be more interest in this beyond the show, and certainly best of luck with it as well. Mike, always a pleasure. Look forward to doing it again. Come on back.
Thank you.
All right. Good enough. We'll come back. We'll be talking to Ron Kessler about the Secret Service. You're going to love this stuff. You'll hear something about LBJ you won't believe. LBJ! That's all next. Keep it here. I'm Ellis, and you're watching Night Talk on PCNC.